Today, I will be working with my client, Kimberly, on exercises that improve laryngeal closure. The larynx, also called your voice box, is the area of the throat that houses the vocal cords. The larynx is a structure that is very important for breathing, speech, and swallowing. In regard to swallowing, the larynx adducts during swallowing events to protect the trachea, which is the airway for breathing. Appropriate laryngeal closure is absolutely crucial during swallowing because laryngeal closure is a part of the airway protection mechanism that prevents food and or liquids from escaping down into the airway. During this video, I will demonstrate two different exercises that can be used to strengthen laryngeal closure during swallowing in order to protect the airway. So I will have Kimberly here with me to demonstrate these exercises. So our first exercise is called the pushing exercise. And this exercise is used specifically to strengthen the muscles of the larynx to improve airway protection when swallowing. Okay, so first I want you to take a deep breath in. Hold your breath, and I want you to bear down for a few seconds on your chair. Now relax and release your breath. Good job. Our second exercise is called the pulling exercise. And this exercise is also used to strengthen the laryngeal muscles to improve airway protection when swallowing. Okay, take a deep breath in, hold your breath, and I want you to pull up on your chair to when you feel tightness in your throat as if you were lifting something heavy. Now relax and release your breath. Good job.
Thanks.
Okay, and Kimberly can leave now. She was a good client. Okay. So these exercises should be implemented for patients with swallowing difficulties that specifically include poor laryngeal closure and or suffered previous laryngeal trauma, putting them at risk for aspiration or penetration. Different conditions that can lead to laryngeal closure deficits include stroke, neurologic diseases such as Parkinson's disease or ALS, muscular dystrophy, esophageal obstruction, and head or neck cancer. As previously stated, these exercises are used to help strengthen the muscles of the larynx for proper airway protection. When you swallow, the muscles of the larynx elevate and adduct tightly to prevent the passage of food and or liquid into the airway. If the muscles of the larynx are not fully adducted during this phase of the swallow, it is possible that food and or liquid will escape into the airway, causing aspiration. Therefore, it is very important to strengthen the muscles of the larynx through these exercises to ensure proper airway protection and to prevent aspiration or penetration during swallowing. There is very little research currently available about the efficacy of laryngeal adduction exercises for dysphagia patients. According to Johns Hopkins Medicine's website, these swallowing exercises can be used to improve the strength, mobility, and control of the laryngeal muscles, which will in turn improve the airway protection mechanism and reduce the risk of aspiration or penetration during swallowing. Their website also notes that repeating these exercises daily for an extended period of time can eventually lead to normal swallowing function. A study completed by Fujimaki et al. In 2017 that evaluated the effects of vocal exercises on elderly individuals with glottal closure insufficiency noted that 3 patients in their study showed increased adduction of the false vocal folds and the laryngeal muscles. The patients in this particular study utilized both pushing and pulling exercises that we demonstrated earlier with Kimberly, which helped with the increased adduction of the laryngeal muscles, indicating that these exercises would be beneficial and would be effective for patients who have decreased laryngeal adduction. Thank you for watching.
a study performed by Thutamaki et al. Today, I will be working. I don't know what to do. So now I want you to gently. Dang it!
This is too redundant.
Oh my gosh. Gently place a finger on the back. Good. You should feel as squeeze into